Hey guys, I'm Michelle from Virtual Hand Care, and in this video we are going to do a beginner wrist rehab exercise routine to help improve our wrist range of motion, our forearm range of motion, and just kind of start trying to get things moving a little bit more normally again. You'll need a volleyball or a soccer ball for this exercise routine. You will also want to make sure that you're sitting at a table, standing at a table to do these exercises. Now, always make sure you check with your doctor before you start these exercises or any kind of exercise program. Okay, exercise number 1 is wrist flexion. So go ahead and place your hand on top of that ball, and what you want to do is just nice and lightly start rolling that ball with your wrist in a little bit of wrist flexion. And we're going to hold that for a couple of seconds, and then we're going to just nice and lightly roll back into a neutral wrist position. We're not going to go all the way back into wrist extension just yet. So we're just going to warm up on wrist flexion. So ready? Go ahead and move forward just to what you can do. Hold a couple of seconds and then come back. So that's 1. Ready? Go ahead and come forward and back. That's 2, and forward, and back. That's 3, forward, that's 4. And you can kind of move around a little bit too if you want to kind of go at an angle or in front of you. That's 5. You can kind of move a little bit off to the side and go forward. Just feeling that stretch. And relax back. That's 6. And forward. That's 7. And again, go ahead and go forward, feeling that stretch all throughout the wrist, maybe the forearm. And back. That's 8. Let's do 2 more. Go forward. You really want to make sure you hold these for a few seconds to really get that stretch. And relax. 1 more. And forward. And relax. That's 10. Good job. Okay, so now for the second exercise, we're not going to go right into the opposite wrist extension. We're going to kind of do a little bit of radial and ulnar deviation. So that's that little side to side movement. So when you go towards your thumb, that's radial deviation, and when you go towards your small finger, that's ulnar deviation. So go ahead and place that hand on the ball in whatever position is comfortable for you. And you want to go ahead and just twist that ball towards your small finger, and then twist that ball towards your thumb side. So that's ulnar deviation and radial deviation. And then back to neutral. So that's 1. So ulnar deviation and radial deviation. That's 2. Ulnar deviation and radial deviation. That's 3. And even if the ball moves just the tiniest bit, that's okay. You are getting some mobility in that wrist that will improve. That's 4. The side of your small finger towards your thumb. That's 5. Small finger, thumb, that's 6. And you can move this around a little bit. Don't be afraid to move that ball a little bit and do this exercise too. Just kind of gets that arm away from always being in front of you, which can be really good on the shoulder too, to get that arm out of that internal rotation position. Back to small finger, to thumb side. That's 7. small finger to thumb. That's 8. Again, move it around to what's comfortable. Side to side. That's 9. And one more. Side to side. And back to neutral, and that's 10. Good job. Okay, this third exercise, now what we're gonna do is we're gonna go into some extension now. So that's where we're going to kind of bring that ball and that wrist and slide down into a little bit of wrist extension, just to what you can do. And you're gonna hold that for a couple of seconds and then just back up to neutral. So that's 1. If you don't have as much pronation and you can't go all the way flat, you can turn your hand to the side and then just use your other hand to turn that ball a little bit. So you can at least work on a little bit of extension that way, if you can't get to where you're in complete pronation on this ball. And try to roll down, trying to keep the palm completely, the fingers completely curled around that ball, really just focusing on that wrist. And back up, that's 2. If you have to kind of stabilize the forearm too, you can always kind of grab this and kind of pull that skin up towards the wrist and then try to bring that wrist down. Sometimes providing a little bit of massage and a little traction when you're doing these exercises can help. And relax, that's 3. And back down. And relax. That's 4. Come back. Hold. And relax. That's 5. Pull back, really trying to go a little farther and farther each time. And that's 6. Roll back into extension, hold a few seconds. That's 7. Again, play around with the position of the ball too. Kind of get it a little farther away from you also, and roll. Get a little elbow extension in there. Pull that wrist back. Hold. And that's 8. 2 more. Pull down an extension. Hold. That's 9. Good job. We got 1 more. Try to maybe take a little step back so you've got full elbow extension and some pronation and then extension. This one's a little more advanced. So if you are having pain, then just go ahead and bring that elbow down a little bit and really just focus on the wrist there. And hold a few seconds. And relax, back to neutral. Good, that's 10. Okay, now our next exercise, we are gonna be working on a little bit of forearm movement. So we're gonna go ahead and pick that ball up and we're gonna work on supination and pronation. So if it's your right hand is gonna go into full pronation or as much pronation as you can. And then you're gonna nice and lightly keep that hand on the ball. And then with the guidance of your other hand, you're gonna rotate. And now your hand is in supination. So you're gonna get some pronation work here and some supination work, nice and slow. Make sure you keep your elbows kind of tucked a little more at your side. If you go out too far with this exercise, you're working more with the shoulder and not really truly getting full forearm rotations. So make sure you keep that elbow tucked at your side or close to your body at least when you are doing this exercise. Ready? Let's do 10 of these. So hand on top, and then rotate to where it is supinated, and then back up to pronation. So that's 1. And that's 2. Nice and slow. You can hold a couple of seconds each way. Really try to stick with that end range of motion. That's 3. Supination. And pronation. That's 4. That's 5. That's 6. Just go to what you can. If it hurts to go into that full rotation and you can't go all the way supinated and this is all you can go, then that's fine. That is your starting point. Go to in that range of motion that feels comfortable for you, but still allows you to get a little bit of a stretch. That's 7. That's 8. 2 more. Go into supination. And pronation, that's 9. 1 more. And that's 10. Good job. Okay, now with this next exercise, we are gonna work on a little bit of speed, a little reaction time, because more than likely you've been a little cautious, probably not used to doing things very quickly. As you can tell, those other exercises we were doing them very slow and very carefully, but we want to get used to moving a little bit faster. And it's really good to introduce that in more of a controlled environment like this. So for this one, what you want to do is just take that ball and you're going to take the hand and just kind of move that ball just with your hand. I don't want you to use your other hand, your uninjured hand with this. So really with this one, you don't necessarily have to count. You can set yourself a timer, maybe do 3 to 5 minutes of this one, or if you want to just maybe do 10 repetitions back and forth, and then maybe you can do 10 repetitions side to side. You can do little circles with the ball, circles clockwise, circles counterclockwise. Just kind of moving that ball around. And as you notice, you're kind of having to use the whole arm, just kind of getting it used to a little bit more normal movement. And just moving it all around. And like I said, move it on the table. If you have some good space, move it around all over the table. Kind of get that shoulder and that elbow and that forearm working. And also getting those fingers kind of helping out too. Pushing it out as far as you can away from you and then kind of pulling that back in. Good job. Okay, so this last exercise is just a little introduction to some very light strengthening. What we're gonna do with this one is just lightly apply a little bit of pressure down into the ball. You can do this either with an open hand or you can do this with a curled hand, whatever feels good on that wrist. If you're really wanting to work on just wrist strength, you're gonna wanna curl those fingers so that the finger flexors aren't really doing the work. Kind of play around with that, see if you notice a difference. But for this video, we're gonna go ahead and at least start with the palm open and applying a downward pressure down into that ball, holding a few seconds, and then relax. And again, play around with the position of this ball. Do a couple repetitions close to your body, a little bit farther away from your body, maybe even getting that elbow in a little bit of extension too. And apply a little pressure down, hold a few seconds, and relax. That's 2. And apply some pressure, as much or as little as what is right for you. Relax. That's 3. Push down and relax. That's 4. Push down. That's 5. Push down. 6. Push down. 7. Push down. That's 8. 2 more. Push down. That's 9. 1 more. Push down. Hold a few seconds and relax. That's 10. Good job. Now I hope you feel like your wrist and forearm and probably even your hand got a really nice workout. Hopefully you're feeling a little bit looser, feeling like maybe you're one step closer to being able to use that hand a little bit more normally after your wrist fracture or your wrist injury. Now, if you found this video helpful, do please give it a like and don't forget to hit that subscribe button below. And if you're looking for more wrist and forearm exercises, then check out more of my videos here. Until next time, thanks for watching.